Welcome to the WMed Specialty Spotlight Podcast, your virtual mentor for choosing a medical specialty and planning a career in medicine. On this podcast, we probe practicing physicians with questions about their specialty, the decision algorithm that helped them determine that the specialty was right for them, and then for advice about long-term career planning, irrespective of the field they went into. I'm your host, Dr. Biren Shah, WMed Assistant Dean for Career Development. The specialty of today's show is Med-Peds, and the physician that is here to tell us about it is Dr. Theo Gomes. Dr. Theo Gomes is the Program Director for the WMed Medicine-Pediatrics Residency Program and an Assistant Professor in the Departments of Pediatric and Adolescent Medicine and Internal Medicine at Western Michigan University Homer Stryker MD School of Medicine. He is a trained internal medicine pediatrics physician. Dr. Gomes completed his undergraduate studies at the University of Maryland in 2005, earning his bachelor's in science in physiology and neurobiology. He performed research in neuroscience at the Walter Reed Army Institute of Research. He went on to complete a post-baccalaureate fellowship within the National Heart, Lung, and Blood Institute at the National Institutes of Health in Bethesda, Maryland. He also trained as an EMT, Basic Firefighter 2, and NREMT, Intermediate Cardiac Rescue Technician before starting medical school. In addition, he was a clinical research associate at the Greater Baltimore Medical Center. Dr. Gomes earned his DO degree from the Chicago College of Osteopathic Medicine in 2013 and was part of the Sigma Sigma Phi National Osteopathic Honor Society. He completed his residency training at Western Michigan University's Combined Internal Medicine Pediatrics program and served as co-chief resident in his final year of training. Without further ado, Dr. Theo Gomes. Dr. Gomes, welcome to the show.
Thanks, Biren. Glad to be here.
And to start us off, I'll read a description of the specialty from the Association of American Medical Colleges Careers in Medicine website. Internal Medicine Pediatrics, Med-Peds, training and practice synthesizes the disciplines of both internal medicine and pediatrics. Med-Ped physicians tend to the care of patients throughout their lifespan. Caring for multiple generations of the same family requires an understanding of family dynamics, epidemiology, and the impact of acute or chronic illnesses at all ages, all in the context of family systems. Med-Peds physicians draws from the knowledge and skills of pediatricians and internists to bring breadth and flexibility in their approach to clinical medicine. This adaptability provides the versatility to follow many paths throughout their career, including patient care as a generalist, hospitalist, emergency room physician, or subspecialist, research, administration, public health, and education. How much do you agree with, and what would you add or subtract to that?
Yeah, I think in general, I think it's a really good description that the AMC provides. I think it's well encompassing. A few background points that I really kind of always talk about when it comes to Med-Peds, when it comes to the context of that description, is that Med-Peds, started in 1949, and previously it was a 2-year rotating internship, and eventually became a 1-year postgraduate program. In 1967, about ABIM and ABP, which is the governing bodies for internal medicine and pediatrics, respectively. ABIM stands for the American Board of Internal Medicine, and the ABP stands for the American Board of Pediatrics. Recognized Med-Peds as a 4-year program right around at that time point. And I think a lot of people really kind of think about Med-Peds as a newer specialty, but the fact that it was actually established in the 1940s, the late 1940s, it really kind of speaks to how long it's been around. And actually, family medicine programs, 3-year family medicine programs, were also created right around that same time. So, in essence, Med-Peds and family medicine are, were essentially born right around the same time. And in general, I think that a good description of Med-Peds training, specifically the residency, is worthwhile mentioning, primarily because I think that as a Med-Peds physician, after a physician graduates residency, the doors are pretty much open to them. So I really kind of like to go into a little bit more of the background of the residency training, and specifically combined residencies, because I think that there are very few combined residencies in the program, and combined with multiple different specialties. And obviously, this podcast isn't necessarily to go into those other combined specialties, but in general, a combined specialty takes the individual number of categorical years of that particular program, and you add them together, and then you subtract 1 from the years of training. So in essence, a Med-Peds program where you have 3 years of internal medicine and 3 years of pediatrics, when you take the 2 and add them together and subtract 1, you really should have a 5-year program. However, Med-Peds programs are 4 years long. And, roughly there's about 500 internal medicine programs across the country and roughly 300 peds programs across the country. But there's about 75 to 80 Med-Peds programs that exist at really kind of any given year. And yeah, in terms of just the description that the AMC provides, you really are seeing the entire spectrum of patients. And a lot of times we kind of coin the term cradle to grave care. And that's really kind of, the type of practice that, Med-Peds provides relative to family medicine.
Do you ever feel as though you're behind in your training relative to a monospecialist pediatric or internal medicine physician?
So you would think that would be the case, since you have, basically 2 dedicated years of internal medicine and 2 dedicated years of pediatrics. And in general, when a Med-Peds resident starts off in residency in year 1, relative to their categorical counterparts of the same year, they tend to kind of feel like they are behind. But it's a lot of literature and a lot of, kind of anecdotal experiences have sort of proven that a 4th-year Med-Peds resident feels just as adequately trained and able to take care of patients as well as their categorical counterparts of internal medicine and pediatrics categorical. So I think that at the time of graduation, a Med-Peds physician really, is able to take care of the entire spectrum of ages, and actually, and then some, because you have the additional, sort of combined piece, and you can offer a lot of insights on the internal medicine side that you can bring from the pediatric side, and vice versa. And so I almost kind of would argue that it's quite the opposite, that they're sort of advanced in their training because they do have an additional year where they, have really been in residency training and can offer insights on the two different worlds.
What is a typical daily or perhaps weekly routine that you see in your Med-Peds service? And what is the typical patient, and what is the typical outcome for this patient look like?
That's a great question, and I think it's sort of what the beauty of Med-Peds is, that there really is no typical, primarily because a Med-Peds physician really has the ability to enter either specialty if they want, or really kind of practice pieces of both sides. And often I kind of say that, like, even 2 Med-Peds physicians in the same practice may not be alike in their job responsibilities. Depending on what a Med-Peds physician wants to do after they graduate and what type of practice they want to enter, really kind of encompasses, either that particular specialty or, inpatient medicine or outpatient medicine. And I think that typical or daily or weekly routine really kind of comes down to, the type of practice that they're actually kind of practicing in that setting on that given day. And by that I mean, reflecting back on my own types of clinical responsibilities, every single day is different for me. And it's really kind of one of the things I like about the specialty and my day-to-day practice is that I can have a myriad of different opportunities. And so on one day, I might be in the internal medicine clinics and I'm seeing adults and I'm seeing hypertension and diabetes, or I could be on the pediatric side and I'm seeing sports physicals and well childs. And so the typical, daily or weekly routine really kind of comes down to if I'm on the internal medicine clinic, if I'm on the pediatrics clinic, or if I'm rounding on the internal medicine services inpatient, and likewise on the pediatric side. That typical daily or weekly routine or that typical kind of practice is dependent on what you go into. And I think that, Med-Peds really kind of brings itself into the possibility of a lot of flexible career options and a wide range of opportunities. So, really kind of those, compartmentalized practices that one might kind of, find themselves in could be private practice, fellowship or subspecialty care. Teaching and academics really kind of affords the ability to serve in a lot of different aspects of healthcare, hospital medicine, research, public health. Really kind of you name it, there's really kind of, a varied amount of patients that a Med-Peds physician can see, and even kind of ranging to like rural practice or international medicine. One of the actually niches that like I think Med-Peds physicians, as far as like the type of patient that they see, can be those that are in transitional care and or complex care. And transitional care might be a concept that like a lot of healthcare providers might not be really too familiar with. But transitional care is sort of that care that spans that transition point between a pediatric patient that goes into their adult medical care. And so an example would be something like cystic fibrosis, where a patient who was seen in the pediatric side, that is transitioning their healthcare to being an adult patient, a Med-Peds provider can sort of help with that transition of care and or be that primary care provider for a patient that started off in pediatrics but then has to graduate into the adult world. But the flexibility of being able to see the same provider, throughout their life.
My next question is how does the practice of your specialty change based on setting, inpatient versus outpatient, academic versus private, public, urban, rural, civilian, military, government, international?
Yeah, and I think it also kind of, speaks to really the versatility in each of those areas, because of all the areas in which you mentioned, you could probably find a Med-Peds physician practicing in each of those areas. And I really believe that Med-Peds training and Med-Peds residencies are amongst the most versatile residencies available and really kind of offer the opportunity to practice in each of those settings. I think that it's what really kind of makes Med-Peds, the best of both worlds on the internal medicine side and the pediatric side. It's really kind of high marketability. A lot of people feel that Med-Peds physicians are extremely valuable because they can serve as that individual that can be, sort of that flex position that they can, go to a particular area where the need is highest. And so, sometimes that might be, one might need more adult level care on the inpatient side than on the pediatric side. And so, that Med-Peds physician can sort of like, flex their roles into wherever they're needed most. I think that you'll probably find Med-Peds physicians in really kind of in each of those settings, academic, private, public. I think they're well suited to be an academic physician. And speaking from my own experiences, I've often been, approached by our medical school here at Western, to sort of serve as a person who, can kind of span and talk about and speak to the care of pediatrics and adults and the disease processes that kind of are linked to both. And so you're sort of a great, educator to be able to kind of speak on at all different levels. And I think that I don't know if I can speak to a lot about the civilian versus military aspect of things, but I do know that many of our residents have military backgrounds and or have military obligations and are planning to practice within, a military setting or practice, after graduating. And I think that as far as just that ability to kind of span the ages, know about a lot of the general disease processes in healthcare today, really kind of make them useful in the governmental or national versus international arena. And one of the things that our program, highlights is our global health. And so, I think that the ability to practice the entire spectrum of ages and have that in-depth level of training in both internal medicine and pediatrics makes them pretty valuable in really kind of urban, rural, and international settings, because in those settings, they're really kind of taking care of the entire spectrum of ages.
Well, what is the one thing you wish you would have known before entering the specialty? And what would you encourage a medical student to think about in earnest before committing to going into Med-Peds?
When I went into Medicine-Peds, there wasn't really of anything that was of great surprise that was, new to me after I entered the specialty. But I think that there are a few things to keep in mind. And really, a lot of it comes down to the rigor of the curriculum. And this is specifically kind of speaking toward the training, and specifically Med-Peds residencies. And when I reference the rigor of the curriculum, it really comes down to when you combine, 6 years of training, 3 years of internal medicine, 3 years of pediatrics into a 4-year length of curriculum, then you do have to really kind of have core requirements that you have to meet on both sides. And so that, creates a lot of inpatient rotations and, a lot less time to be able to get into elective rotations than you would if you were in a categorical program. And so it's really kind of the rigors of crunching two entirely, different specialties and the important parts of each into a 4-year curriculum. Some have kind of often talked about, some redundancy in the specialties in internal medicine and pediatrics, primarily because our curriculum incorporates having to spend time in the, cardiology rotation on internal medicine and the cardiology rotation in pediatrics. And so one might think that there might be a little bit of redundancy there, but it really kind of allows the full spectrum and awareness of the similarities and the differences, because adult and pediatric cardiology are very different from one another. And so I think, again, I almost kind of feel like whatever specialty you speak about and, taking care of the adults in that specialty and the pediatrics in that specialty, it really becomes more synergistic, because I think that not only do our providers and residents and, general Med-Peds providers know about just one part of each, but also kind of like the parts that really kind of complement each other and on each sides that the categorical providers might not necessarily be too aware of. Another thing that not a lot of individuals who enter Med-Peds really kind of think about is the board examinations and the maintenance of those examinations. One, the cost of boards. Board certifications are a pretty expensive and lengthy process, and when you have to be in the process of maintaining 2 boards, then that brings an added level of responsibility and maintenance. Kind of beyond that, if a Med-Peds physician wants to subspecialize, then that brings more board certifications and maintenance. There is no combined board examination for Med-Peds. That's important to note. So we, as Med-Peds physicians, will take our internal medicine boards and our pediatrics boards, and it really kind of shows that we are held to the same standards of each. And so, which is the reason why we really consider ourselves, full-fledged pediatricians and full-fledged internists using the same benchmarks. But, again, that does bring a lot of maintenance and costs of maintaining those certifications in the long run. And then one last thing I wanted to kind of mention was, especially the reason I mention this is because a lot of those who are entering Med-Peds are interested in becoming a combined internal medicine and pediatric hospitalist. And I think the big thing in the news and kind of an evolving training requirement on the pediatric side is something called the PHM, or the Pediatric Hospital Medicine Fellowship. And basically what that is that's an additional fellowship that will afford those who graduate to practice as a pediatric hospitalist. And that extra requirement isn't required on the internal medicine side. And so that is a hurdle that some of our Med-Peds physicians who want to become combined hospitalists have to kind of tackle, to see if they would need to consider, finishing a PHM fellowship to be able to practice what they want to do as a hospitalist on both sides.
What is the biggest challenge facing your specialty, and where do you predict your specialty to be in 10 or 20 years?
I think that's a good question. It probably varies, over time. I think really kind of the biggest challenge is the awareness of Med-Peds providers across the country, because I think that the internal medicine sides and the pediatric sides of most institutions and hospital settings are very two separate entities. And it's really kind of difficult to maneuver between the two, except in those institutions where you have a Med-Peds training program or there's a high level of Med-Peds providers that practice in that setting. And I think that over that 10 or 20 year span, as we tend to have more and more Med-Peds providers that start to enter the workforce, I think that that level of separation will probably start to diminish. And I think that there will probably be a little bit more overlap and more flexibility that is really kind of afforded by more Med-Peds providers as they become more apparent in the workforce. I also think that it's the other thing to kind of consider is that we are sort of a world when it comes to medicine that's moving toward more specialized care. I think that a lot of providers are entering specialties rather than going into primary care. And it's really harder to be a generalist. And really kind of that Med-Peds mentality has been that we really like to take care of everything, span the entire ages, think about all the disease processes on both sides. And so it's a little bit harder to become a generalist. But I think that what is unique about Med-Peds is that they do give the flexibility and opportunity to be able to specialize in any of the internal medicine specialties, in any of the pediatric specialties, and specialize in combined Med-Peds specialties. And so even though we're kind of moving toward specialized care, Med-Peds providers are still very valuable in the workforce, primarily because they can enter generalist practices as well as subspecialty practices.
I get asked from students about, or they're contemplating between family medicine and internal medicine pediatrics. What would you say are the differences between the two specialties?
Yeah, I think that's a great question. I think a lot of providers who are considering Med-Peds as a specialty have often considered family medicine as a potential specialty. And there are a few big differences. I think that family medicine trains their providers, their residents, those who are entering the workforce, into more outpatient care. There are a lot of family medicine residencies that do have a lot of inpatient training and are also considered very inpatient heavy. And many family medicine practitioners are, working in the hospitals in inpatient settings. But I think that in general, a family medicine residency provides the expertise in being able to see patients in the outpatient world, whereas Medicine-Pediatrics has more of an inpatient focus. The other major difference is that most curriculums in family medicine will incorporate obstetrics and gynecology and surgery, whereas most Medicine-Pediatrics programs will not have that as a component. And so a lot of individuals who are really, not drawn to the surgical and or obstetric and gynecological fields tend to, favor Medicine-Pediatrics over family medicine. The other part is that most internal medicine pediatrics training programs we are, essentially our residents will go through 48 months in each specialty. And so that's 2 dedicated years of internal medicine, 2 dedicated years of pediatrics. Whereas in family medicine, depending on the curriculum, the number of pediatric rotations really kind of range anywhere between 2 to 4 months. And so the pediatric training is a lot more in-depth and more vast when it comes to Med-Peds residency programs. And although I kind of say that there's 48 months of training in each specialty, there's no Med-Peds programs where you actually have 2 years of dedicated internal medicine and 2 years of dedicated peds, one after another. Usually it's an integrative curriculum. And so most programs will have anywhere between 2 to 6 months of internal medicine at a time, and then 2 to 6 months of pediatrics at a time. And so our own program here at WMed, our residents switch between the 2 specialties every 3 months. I think another difference between Med-Peds training and family medicine training is the level of inpatient that is provided as far as training goes on the Med-Peds side. So most of our Med-Peds residents have quite a bit of extensive exposure to the critical care fields. And so they do pediatric intensive care unit, they do neonatal intensive care unit, they do all the adult subspecialties of adult intensive care units, so the medical ICU, the cardiac ICU, the surgical ICUs. And so a lot of our Med-Peds residents will have pretty in-depth knowledge and be able to take care of the most critically ill patients that I think that a lot of family medicine residencies might not be able to provide just based on the number of rotations that they're able to do in that curriculum.
And would you say that as a graduate of an internal medicine pediatric residency program, the fellowship opportunities are wide open?
Yes, and actually, it's one of the great parts of opportunities and flexibility of the field is that when you look at and there's a list on some of the resources that are helpful for exploring Med-Peds as a career option. There's a list of all the different specialties that the fellowship opportunities that are available for Med-Peds, internal medicine categorical, pediatrics categorical, family medicine. And if you look at those opportunities, internal medicine peds have the most number of fellowship opportunities available to them. So they have, again, all the internal medicine fellowships available to them, all the pediatrics fellowships, all the combined medicine pediatrics fellowships, and really kind of all the fellowships that are lower in number of years, but span the entire spectrum of ages. And so some of those are sports medicine, sleep medicine, and allergy and immunology, where you can have the same number of years of training, but still be able to see both adults and pediatrics within that specialty.
What resources would you recommend students to use to learn more about internal medicine pediatrics?
I think my go-to resource has actually been the National Med-Peds Residents Association website. And I always say don't let the name fool you, because even though the acronym stands for the National Med-Peds Residents Association, it's really dedicated more to the entire field and a large emphasis for medical students. And there's an entire section for medical students within the NAMPRA website. And I usually will refer a lot of my medical students who are interested in Med-Peds to that website, primarily because they have a dedicated question and answer section in there that really kind of goes into depth about a lot of the questions that a lot of med students have about the specialty, including a lot of the questions that you've asked me, actually, Biren. It's really kind of well laid out into that medical student section. The NAMPRA website is huge, and I often refer a lot of students to that. And they also host a Med-Peds webinar series that usually takes place in the summer months. And it's really popular. I think that they have a probably set of like 7 to 10 different webinars that are really kind of dedicated to all years of training for first years, for second years, for third and fourth years, that are really kind of more thinking about what to do as they prepare for their applications. And then it also has webinars that are dedicated to osteopathic students, international students, those medical students that are thinking about the specialty where they don't have a lot of exposure to Med-Peds or don't have a Med-Peds program at their institution. And so it's a really great webinar series to be familiar with and definitely check out. They're very short, they're very high yield. And then furthermore, kind of along that same, the same individuals who set up the NAMPRA website and the Med-Peds webinar series, they have a mentorship program specifically kind of geared toward those who are interested in Med-Peds that don't, again, have a Med-Peds program at their institution and who might have difficulty finding someone to talk to about the specialty. And so it's really kind of an open mentorship program for anyone across the country who will be paired up with either a Med-Peds program director or associate program director or some other faculty member within the field to get some more insight.
Can you tell us about how you decided that Med-Peds was the right specialty for you?
I had a long, career kind of, getting into medical school in the healthcare field and research. And initially, considering my experiences that you so aptly were able to sort of encompass for the introduction, I did a lot of emergency medical care as an EMT basic and firefighter and paramedic. And initially I was drawn to emergency medicine. And it wasn't until probably entering my third year of medical school where I really was able to think about what I wanted as a career path and what was important to me. And one of the main reasons why I went into medicine in the first place was just the complexity of care, the really kind of interesting diagnosis and pathologies that affect the human body, and really wanted to think through disease processes. And that was, really kind of what drew me into internal medicine. And as I got further into my rotations as a medical student, I did a rotation in pediatrics, my core pediatrics rotation. I did at Advocate Christ Children's Hospital, which when I was going through medical school, it was previously called Hope Children's Hospital. And that was that rotation that basically turned anyone who did that pediatrics rotation wanting to do pediatrics. And I was no less. I think after I did that rotation, I just fell in love with just all the different complexities of care for a pediatric patient. And that was actually the rotation where I met a Med-Peds physician for the first time. And although that Med-Peds physician was someone who practiced mostly pediatrics, it was a concept that I was really kind of drawn to. And I think that what happens often in medicine is that we try to emulate those individuals that we're kind of, like drawn to and admire. And I really admired this particular, Med-Peds physician. He had a really great personality, great way of running rounds and picking apart, certain disease processes and topics. And I, essentially looked at this individual and I said, wow, I want to be like him when I grow up. And so that's, I feel like, where my love for Med-Peds kind of started. And thereafter, every other internal medicine rotation or pediatrics rotation that I was involved in, it really kind of strengthened my desire to go into the field. And that was probably what drew me into Med-Peds.
If you were a third-year medical student undecided on specialty with limited time remaining before residency applications were to be submitted, what do you think would be the fastest high-yield route to making the decision about the specialty?
Two things. I think one, to be familiar with sort of the ins and outs of the specialty. And I think that's where the NAMPRA website, the medical student section, comes into play. It's not a lengthy, part of the website that talks about the specialty, and really kind of reading through it and thinking about what one's career goals are in reference to what's on there as a description of kind of those questions and answers. But really kind of taking it to the next level also and speaking with a Med-Peds doc. And that could really be in any Med-Peds doc. I think that most Med-Peds physicians know the ins and outs of the specialty and sort of kind of the current, happenings in that specialty. And so I would encourage a third year, medical student to review the website and then try to connect with a Med-Peds physician. And then really kind of having that discussion of, how they can sort of play into what's important to them and how they can sort of, situate themselves in, good standing to kind of set themselves up for success in the field. I would also kind of encourage medical students really kind of, for any specialty to make, and this is kind of what I did when I was going through, deciding on what was important to me, is I actually made an Excel spreadsheet, and I basically jotted down everything that was important to me, whether we went from the specialties that I was interested in, the geographic area in which I wanted to practice in, and really kind of write them out so that I knew what was important to me, and then really kind of look at the specialties out there and figure out if they are really kind of in alignment with what you want to do as a long-term career.
Do you feel that away elective rotations in Med-Peds is necessary?
That's a great question, primarily because one, sometimes it's hard to find those combined rotations. There are several programs that offer a combined internal medicine and pediatrics rotation. And the way they sort of will structure it is that you'll spend time on the internal medicine side and on the pediatric side in both the inpatient and outpatient settings. And there might be a component of, some research and scholarly in there. But I think that they're very few and hard to come by. Audition rotations can help increase one's chances of finding a good fit into a program. But I don't think that a combined Med-Peds rotation is something that's required for getting into a good program. I do know that there are a few virtual electives that are offered. I know that Christiana Care offers a virtual elective to learn more about the specialty and some of the resources that are out there for that they have for kind of what they do. But I don't think that that's necessarily something that I always look for in an application. I think that, again, kind of core experiences and doing well in the core internal medicine, core pediatrics rotations would speak for themselves.
How important is research or scholarly productivity in matching into this specialty?
Generally, research and scholarly work is always looked upon favorably, but there's not any particular, topics or things that really kind of define Med-Peds, to try to enter the field. I mean, I think that in general, some things that are unique to Med-Peds might be that transitional care or complex care. But I don't think that those are required. I think in general, really kind of being invested in the type of research that interests the medical student is something that probably weighs more. Something that you can really kind of speak to about in application in interviews is probably more important. We want to know that you're dedicated and not necessarily doing research just to kind of do that particular research.
Is there anything else a student can or should do to be competitive as a competitive applicant in Med-Peds?
I think all the things that make an applicant competitive in any sort of field that they go into is going to be helpful. I think it comes down to just being genuine, really kind of knowing what your passions are, what drives and motivates you. And what kind of is the specific motivating factor for entering specifically Med-Peds, and really kind of having those solidified in one's mind is probably going to be more important in making an applicant competitive than anything else.
Give us any advice for long-term career planning, irrespective of your choice of specialty. If you could go back and do it all again, what would you do differently? And what would you do the same and why?
So I think if I were to do it all over again, hands down, I wouldn't change a thing, actually. So when I was applying to Medicine-Pediatrics, I didn't apply to any other specialty. I didn't have a backup or parallel plan. For me, it was Med-Peds or bust. And so I love the field. I would totally do interview at the same programs. I think I'd probably apply a little bit more broadly. But honestly, I was happy where I came. I had a great time, and I think that really kind of any path is sort of meant for a reason, and I'm glad that I took the path that I was able to take, and I have no regrets. And so, I think when it comes to descriptions of like med-peds in general, I think for me, we always talk about med-peds as MP, and so a lot of times, many individuals, even within med-peds, we kind of describe them as big M, big P, little m, little p, and that kind of is sort of shorthand for what one might kind of be more interested in over the other. So someone who's big M, little p might be more interested in medicine and a little bit less interested in pediatrics. And I really consider myself big M, big P, and I like both specialties just as much. And I think going back, if I were to do it all over again, I don't think I'd really change a thing.
What is a career mistake that you've seen other physicians make? And what is something that you've seen another physician do well that has made you want to emulate it?
I would encourage those who are thinking about, any particular career path or specialty or residency training. I would say don't let certain external factors be the sole determining factor of what you want to go into. And so by that I mean, if you're a medical student who's taking their shelf exams, if you do well on a particular shelf, don't let that be the dictating factor of going into that specialty. And I say that because at one point I think I was taking my shelf exams, and I think I did the best on my surgery shelf. And I'm glad that I went into med-peds and not surgery. And I'm glad that there are surgeons out there that want to take that career path, but you should look at things as a whole, and all the different aspects of why you want to go into something, and not look at particular scores or particular experiences. I think the best thing in choosing a career path really kind of comes down to finding someone that you think really kind of where you see yourself, in that person, someone you can emulate and someone you can look up to and admire. And if that's that person that is in a particular career path, then it might be also very suitable for you. And so again, I kind of encourage making a list of what's important to you, and think about what brought you into medicine in the first place, and really kind of linking those two and figuring out the next steps after that. I will say that try to make and create good habits early, and that comes down to making really good habits in medical school, and even earlier if that's kind of when you're thinking about a career path in medicine. Try to look out for your peers, don't cut corners. Most importantly, I think be responsive to communication, and I think that those are probably things that are hard to always stay on top of, especially for physicians. And when it comes to career, mistakes, I think that those are probably the areas in which, those mistakes can happen. If you don't look out for your peers, if you tend to cut corners, or if you start to kind of, fall back on communication. And so I would, encourage everyone to sort of, create those habits for especially those three areas early. And I think that would set individuals up for success in the long run.
What is one thing you're struggling with or lamenting about your career today? What are you doing to remedy it? And what would you encourage a medical student to do right now to help avoid this problem entirely later?
I think one big thing is, taking on too many tasks. I know that you could probably say that about many different specialties or lines of work. But I think it applies to Med-Peds very well. And I know that we talk about generally, just a general advice, but I think it applies to Med-Peds very well, primarily because when you have two different specialties that are encompassed into one, the individuals who you might work with on one side versus the other only see you essentially kind of for half the time, depending on what you do. And so there's always this perception that you're only doing half as much work because that's kind of the only parts that's seen. And so invariably inherent in that is falling into the trap of taking on too many tasks. And so to really kind of remedy that, and it's something that I've really kind of personally have done as well, is within that spectrum of all the responsibilities, pick those things that you like. And sometimes that may lead to having you to say no to things that you aren't too fond of and or drawn to. And so I would encourage really kind of anyone who might be, potentially like struggling, is to pick the things that you like and really kind of drop the things that you don't. And especially in Med-Peds, I myself personally will try to do the things that are fun and that I find valuable and are in alignment with my own likes. And I think that's probably something that would be really kind of excellent for long-term career planning and dealing with struggles, but also, for wellness, which I think is going to be huge in, really kind of, any work, any line of work, but especially for physicians, where a lot of them, tend to become burnt out and are struggling to kind of, find value in the work that they, initially were drawn to when they went into medical school. And so really kind of finding those things that you like and making yourself, well in the process.
What is one book, medical or non-medical, that you think every person pursuing a career in medicine should read?
One of the things that like my wife and I have done, and this may sound silly, but we used to, we would read books to each other. And one of my favorite books that I have recommended to many medical students is called When Breath Becomes Air by Paul Kalanithi. It's a very well-written book. They had a foreword by Abraham Verghese. It was published posthumously. And it's really a story of a neurosurgeon in residency who is battling with stage 4 metastatic lung cancer. And the reason I recommend this book is because, again, it's a really great read. It reads very well, especially if you try to read it out loud like I did. But I think the reason why I like this book and why I recommend it is because it really puts into perspective why we are called into medicine, and then really kind of being in the perspective of being a patient in medicine. And I think it has a lot of great points, a lot of emotions that are kind of, well integrated into the book. And I think it really kind of forces one to think about why, why medicine is such a field that is just really impactful for really kind of everyone. It really kind of spoke to why I went into the field, and the humanistic components that I want to be able to employ in my everyday life.
Dr. Gomes, I really appreciate you taking the time out of your busy schedule to talk to me. For the resources that were mentioned in this episode, you can find them in the show notes on the WMed website. If you liked what you heard, please share this episode with your fellow medical students, especially if they're having some career anxiety, because it's truly my hope that these conversations with physicians who have been there and done that will help you move forward with your own career choices. For any questions, or if you'd like to reach out to me for any reason, which I encourage you to do, you can do so by emailing me at biren.shah@wmed.edu. But until next time, take care.